Hey students, heads up! We'll be learning new stuff for today, the LEOPOLD's maneuver. But first of all, I'm going to introduce myself to each and every one of you. My name is Sabra of BSN 2-1, and I will be your guide to Nursing 107, the care of mother, child, and adolescent. So what time is it? It's time for learning! LEOPOLD's maneuver as a systematic method of observation and palpation to determine fetal position, presentation, lie, and attitude, which help in the predicting course of labor. It consists of abdominal examination divided into 4 steps of palpation. The purpose is to identify presentation, position of the fetus, and aid in locating fetal heart sound. The materials needed for this is bed, pillow, and top linen. There are factors that are affecting the performance of this maneuver. First, difficult to perform in obese women. Because of the layer of abdominal fat, it is much more difficult to palpate and can sometimes be uncomfortable for the patient. Woman with hydramnios. It is a condition that occurs with too much amniotic fluid build-up during pregnancy. And woman with full bladder. This procedure may feel uncomfortable to the patient, especially with full bladder, as we palpate areas that are usually storage area of our urine. Here are some nurses' considerations before we proceed to the procedure. First is to explain the procedure to the client. Second is to drape patient properly. Third is to instruct the patient to empty her bladder first. Fourth is to palpate with warm hands to avoid tensing of abdominal muscle. And last is to palpate with the use of palm, not finger. To begin this procedure, we must first take these considerations. First, identify the client. Second, introduce yourself. Third, provide privacy. Fourth is to document each procedure and its finding. And fifth is communicate with a smile. We will start to communicate by saying, "Good day, ma'am. I am Sabra. Your nurse will be accommodating your care for today's clinical visit. May I know your name and age?" "Good day, too. My name is Mrs. Smith and I am 32 years old." Alright, Mrs. Smith. For today, we're going to do a LEOPOLD's maneuver. But before we start, you need to empty your bladder first to ensure comfortability. And after that, we will start a short and sweet procedure. As the patient is done, we must remember to do the hand hygiene first before we do anything else. Then assist the client to lie on the bed on a dorsal recumbent position to relax abdominal muscle and carefully expose the part to be examined. And remember to drape properly for their privacy. Keep in mind to assure client from time to time about the comfortability and the procedure that you're doing and that the procedure will only last for a short period of time. First maneuver is the fundal grip. What lies in the fundus? We palpate the fundal area to determine the fetal lie, or the relationship between the long axis of the fetus with regards to the long axis of the mother. In this, we'll be able to know if it is an longitudinal lie or a vertical lie. Head is more firm and hard, which moves independently, and bridge is less well-defined, soft, and move conjunctive with the body. Next is the umbilical grip. To answer the question, where is the fetal back? One hand will feel smooth, firm, and resistant in surface, while the other will feel an angular nodulation, which is the knee or elbow of the fetus. This is important to know where to place the stethoscope in determining the most accurate site of fetal heart sound. Third is the pollex grip, to determine the fetal engagement and fetal presentation such as cephalic presentation, bridge presentation, or transverse presentation. The last maneuver is the pelvic grip. This maneuver is to determine fetal attitude and degree of extension into the pelvis. After the maneuver, carefully assist the client to get up from the bed and do the hand hygiene. Do not forget to document all your findings on the client's record. Communicate with the client that you are all done with the procedure and that the doctor will let her know everything else. Bid goodbye to the patient as you finish the appointment. And that's it. As we venture the learning of LEOPOLD's maneuver, I hope to give you a clear knowledge that can help you achieve that RN. Again, my name is Sabra of BSN 2-1. Goodbye and see you on the next adventure.